I'm the Group Medical Director at Nuffield. I've been here just over a year. My responsibilities really are to advise the company on health and scientific strategy and matters. And then the day job, if you like, is managing non-financial risk, so something we call integrated governance. So that's all areas from clinical risk right through to health and safety or infection prevention or patient satisfaction, all the things that add up to quality healthcare. Nuffield's had to change like any other organisation with these times, so we've embraced what we call the Nuffield landscape, which is looking at health right across the spectrum. So that's not just fixing problems when they occur in hospitals, it's preventing issues before they arise in what we call our wellbeing division. So as part of that change, as with any good company, we rebranded, we've become Nuffield Health. Well, what we're trying to do is really join up healthcare so that patients, consumers can develop a relationship with a trusted healthcare provider so that we can become part of people's health needs right from screening before people develop problems, but for say if somebody's having a hip replacement for us, trying to get to the position where we can look after them before they come in for the hip replacement and then looking after them afterwards once they've had their hip replacement in the fitness and wellbeing environment. What we really mean is managing risk, and health isn't any different to any other organisation. Things can go wrong, and we kind of look at risk in three areas. We look at it in terms of the quality of what we do, the safety of what we do, and the outcomes that we deliver following the care. So we break that down into lots of different pieces. So many people will recognise the things that have been in the media in the last year: infection prevention, for example, or information security, losing pieces of information. So these are obviously areas that we work on very hard. But then there's the other major areas like health and safety that a business like ours needs to get right as every day of the week. Well, I think our patients always tell us that the most important reason for choosing a healthcare provider is infection prevention and the avoidance of things like MRSA. Last year we did just over 365,000 operations, and there were only 2 unfortunate cases of MRSA bloodborne infection. That rate is incredibly low, and we work very, very hard with our clinical teams to look after the standards of infection control in our hospitals. So we kind of have the systems of processes so that Nuffield started screening way before it became popular in the media. We've been doing deep cleaning for years, way before it became popular in the media. So we always like to make sure that we're on the front edge so that the things that really matter to patients are integrated into every day in our business. Well, healthcare is special in some ways, in that obviously there are very key risks. Now, I think if you looked at the oil or the aircraft industry, they would say that they look after these in a very carefully controlled environment, and healthcare is moving like that in this country. Nuffield subscribed to something which is called the NHS Litigation Authority standards, and these are risk-based standards that measure what you do for each and every patient every day of the week. Not what you say you do or not what you think you do. They actually come and have a look at your processes and your policies and whether the staff and people on the ground are actually delivering to best practice. There's 3 levels which we can be measured against, and when Nuffield started doing NHS work, we were obviously measured against level 1 in January 2007, and then we successfully passed our level 2 assessment in December of 2008. So we've made rapid progress against this, because quality isn't an add-on for what we do, it's embedded in everything that we aim to achieve. Yeah, it could be seen as a quality mark, and all NHS organisations are obliged to go through the process, and now the independent sector is has been invited for the past 3 years, and Nuffield is the only independent provider to hold level 2. We were the first to get to level 1, and of course I'd point out that we scored 50 out of the 50 domains, so we have quality embedded right through the sexy areas like infection prevention, but right through to the perhaps more mundane like manual handling. But we know that all of these things are important, and ultimately it delivers better care, and it might actually be cheaper to deliver in terms of good quality healthcare, so there's potentially a win-win there. I think we learn a few things from doing this. I think it can be an early warning indicator whether patient care has been delivered satisfactorily. I think it can offer us other things in terms of risk to understanding whether we've got problems in particular areas or particular hospitals. I think it can tell us a bit about our pathway of care. Are we using the right types of instruments or the right types of people to help our patients? We can really compare things right across the board, so it's going to be, it's going to be a very powerful tool.